hormone replacement therapy right for? And then what factors should be considered when deciding whether or not to go on HRT?
Well, we could talk for all day about this topic, but to put it really briefly, I mean, there are certain things that are indications for hormone replacement therapy. And the main ones of those are treatment of hot flashes and night sweats, what we call vasomotor symptoms, for prevention of bone loss, which is a really another huge important topic that, women should be aware of. Sure. It doesn't have the formal indication for mood, but estrogen is very well known to serve really as an antidepressant in perimenopause and menopause, especially for symptoms that have first time shown up in this period of time. So mood, sleep, and also the whole, pelvic health as far as vaginal changes that occur with menopause. Local estrogen is the first line therapy for that. So those are the real indications. Now, there are a few contraindications, one of those being having a personal history of breast cancer, having a history of either a heart attack or a blood clot or a stroke. These are thrombogenic health concerns because estrogens can increase a risk of having a blood clot. So anything in that realm, and then certainly allergy. But there's really not that many contraindications. There's a lot of gray areas that need to be discussed. But for example, having a strong family history of breast cancer isn't necessarily a contraindication. It's certainly a good discussion to have about what your particular risk could be, but it's not a contraindication. I have many patients who come in being told, hey, I've been told my whole life because my mom had breast cancer that I can't take hormone therapy. Well, actually, you probably can, but we definitely need to talk about it and flesh that out. So, so that hopefully generally sort of answers your question.
Yeah, no, I think that's great advice. And I think obviously we've been talking about that a lot just this year.
Sure.
Yeah. And so the stigma is changing a little bit around, I would say it's shifting for hormone replacement therapy. So if somebody was hesitant to consider hormone replacement therapy, what sort of advice would you have for them?
Well, I think advice would be one, make sure you're getting any information that you have from good, reliable sources. And that's why we're so appreciative that they are being developed by people like you. Also, the Menopause Society, which has formerly known as the North American Menopause Society. I think as of this week, they changed their name and dropped the North American of it. So the Menopause Society is a wonderful resource for, good vetted information for patients and for healthcare providers. So that's a great place to look. And then, talk to your healthcare provider. Start with your primary care and your OBGYN about what are my actual risk and what are my potential benefits. Because one of the really important things that we've learned subsequent to the Women's Health Initiative trial is that the timing of when you talk about this and when you initiate this is very, very important. There is a window when you have a great potential for benefit from hormone therapy. And if you pass that window, it goes 10 years with, since your period stopped, and then you come in and say, hey, I'm still really not sleeping well, and it's been, over a decade, then we have some concerns, and those risks might be much greater. So, and also that loss of, preventing bone loss and all the other different benefits you have during your 50s.
Okay. Yeah. It sounds like having a conversation early is very important.
Right.
Hey. So, as we sort of move through this discussion, we've covered a number of different things. So Dr. Ali, what are some common misconceptions you hear about menopause, and what about menopause treatments that you hear common misconceptions?
I mean, the biggest one is the fear about it, that it's going to cause breast cancer. And it's so unfortunate that, that message was just broadcast so broadly. And so I think for sure that's the biggest misconception. I think we've touched on it a little bit, but one of the things I do like to point out to women is that just an explanation of what the Women's Health Initiative was and the things that we have learned subsequent to that, which in a nutshell go back to that timing of initiation, which again is really important. And then, just that when the Women's Health Initiative trial was set up, the formulations that were most popularly used were Premarin and Prempro, which actually I rarely use now those. And we have a lot of other options in terms of estrogen and progesterone formulations. And that, when we use the FDA approved bioidentical formulations of these hormones, we do have some evidence, although it has been mostly observational, to suggest that the progesterone bioidentical form that we have may not be associated with as much of a breast cancer risk as we had seen with medroxyprogesterone acetate, which was the synthetic progesterone that was studied in the Women's Health Initiative. So there are a lot of sort of nuances to the kind of generalities about the concern for risk. So I think that is, definitely the biggest misconception. What others might be that, you have to do like compounded or pellet. Like there's a lot of confusion about, what does bioidentical mean and what is the safe way to go about it. In our community here in Texas and probably nationwide, there is a lot of kind of demand and interest in, bioidentical hormones as far as serial lab testing and pellet therapy and all sorts of things. And so confusion about what the safety is of that. And, sometimes presumptions that are made about safety of one thing versus the other. So these are all really good in-depth discussions to have with your doctor or provider to sort of flesh out, what is actually going to be safe for you and what is necessary versus kind of extra.